Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Jan, and every week I'm chatting with Dr. Clifford Yudelman. We take a deep dive into the world of dental care from a consumer's perspective. So whether you are looking to brighten that smile or protect your wallet, we have got you covered with practical advice and the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and also your finances. Today, a very interesting topic, handling dental emergencies. Dr. Yudelman, welcome back once again.
Hi, Ian. Thanks for having me back again. Really enjoying doing these podcasts, and I hope people listening today have heard some of our previous ones and will stay tuned for more helpful information. I'm so pleased I've got the opportunity. Thank you.
No, thank you so much to you for joining us and sharing your expertise. It's so interesting and insightful. Every single week I'm learning something. It feels like I could qualify as a dentist, eventually.
Oh, thank you. That's my goal. People need to be their own doctor and dentist.
Yeah.
These days there's a lot of information on the internet, but it might not always be the best information, and I'm trying to balance it and give people consumer power to know my own opinion. And thank you very much.
And you're doing very well. Thank you so much, Doctor. So today, now we will definitely know at the end of this episode what we need to do in a dental emergency and what you do in a dental emergency. But let's quickly start off with the question, what actually qualifies as a dental emergency, Doctor?
So today we're talking about dental emergencies, truly things that are unexpected. We've spoken before about sensitivity and toothaches and bleeding gums. And these types of things generally creep up upon you, and then by a Friday afternoon, especially before public holiday on the Monday when it's a long weekend, somebody can now have what they think is a dental emergency when the tooth has actually been getting progressively sensitive all week. The types of emergencies we're talking about today is something unexpected. So things like severe pain or swelling. So if you've got pain or swelling, it indicates an infection or a significant injury, and that needs prompt attention. A knocked out or a detached tooth, immediate treatment can save the tooth. Uncontrolled bleeding, this requires urgent care to prevent further complications. So those are the types of emergencies we're going to talk about today.
Okay, and let's say I'm playing sport outside and bam, there goes a tooth, thanks to a ball hitting me in the mouth. What on earth would I do now?
Okay, so that's a good one to start with. So if it's yourself or a kid playing sport, first of all, any kind of contact sport like rugby or even basketball, things like that, where people get hit with elbows, one should always get or make sure you're wearing a properly fitted mouth guard or gum guard. The ones that you get in the shops are pretty good these days, but one made by your dentist would really work better. So if you look at someone and there's a lot of bleeding in the lips or the lips are cut, you can generally expect that the tooth will still be in place. But if somebody's got their mouth open and they happen to be smiling or laughing and then something hits them straight in the tooth and it's not cushioned by a lip, it can knock the tooth clean out. And I think that's what you're talking about here. So it's very important to keep the tooth. You want to keep it moist in some milk or saliva. You don't want to touch the root of the tooth. So when a tooth gets knocked out, there's little fibers. Imagine like you pull a carrot out from the ground and you look at those little strings hanging off the end of the carrot. There's fine little hairs. And it's the same with a tooth. So you want to only handle it by the crown of the tooth, not by the root. If it's dirty, you can rinse it gently underwater, but don't scrub it or use soap. If you're in the middle of a rugby field and there's nothing, there's no tap or anything, the patient or the person who loses the tooth, there'll be a lot of blood. They can literally, spit on it or suck on it gently, and the sooner you get the tooth back in place, within seconds or minutes, every minute counts. So basically you want to just try and gently reinsert the tooth into the socket and hold it in place by biting down on a clean cloth or a piece of gauze. You want to keep the area clean, avoid eating or drinking anything other than water to reduce the risk of infection. Use over-the-counter pain relievers to manage pain until you can see a dentist. Obviously, staying calm is important so you can think clearly and act quickly, and this increases the chances of saving the tooth. And then you really want to see a dentist as soon as possible. So I would go, if you've got your own dentist, like at OptiSmile, all of our phone numbers, the individual dentist numbers are on the machine for patients of record. You'd find it hard to get a regular dentist to come out and see you immediately. So the best thing is to go to the nearest emergency room. Most hospitals' emergency rooms have an oral surgeon on duty that the ER person will call. You really want to get a dentist to look at that. And once the tooth is held back in place, it starts reattaching immediately. And it needs to be pushed all the way back into the socket. If there's no bone or anything broken, which is often the case, the tooth is just literally knocked out, it should fit back in really well. And then a dentist would splint it. They would put a little wire or piece of composite, and they don't want to splint it for too long, just for a short period of time until it reattaches. It doesn't always need a root canal. The tooth can actually stay vital. But yeah, you don't want to wait 2 or 3 days. You want to really try and see a dentist immediately.
Doctor, that sounds unbelievably painful. Is it actually painful when you lose a tooth? I remember as kids, my brother I think he was on a scooter or he was skateboarding and he fell on the tar road and he actually lost his one tooth. I remember it was hanging by a thread. That thread you just mentioned now and the carrot analogy, that's brilliant.
Yes,
that's what I saw.
Yes,
there was a lot of blood.
Yes.
That's also what I remember.
Yes. So literally, if I'm sorry to hear that your brother lost his tooth, but if somebody was calm and just calmed him down, and in that case where the tooth is still hanging there, you can actually just push it straight back in. Just stay calm, and you just push it straight back in, and then have him bite on some gauze. There shouldn't be much pain at all, to be honest, because you go into a bit of a state of shock, and you've got endorphins. The nerve in the tooth tends to, it's different to the kind of pain that you would get if a tooth was broken and the nerve was sticking out of the tooth. A tooth that's been dislodged or avulsed, especially if it's only partially, the sooner you get it back into place and hold it in position, the less pain and swelling and infection and any kind of complications there is. And that's why this first point, I'm pleased we started with it, because that's very important.
It's so good that you mentioned this now, and the good news is we actually managed to save his tooth. I think my aunt pushed it back in, and then we actually went to the dentist, but he still got it today, and it's fine.
Oh, brilliant.
Yeah, so we managed to save it, but at that stage, with it dangling out of his mouth almost, it looked like it was a goner.
Yeah. Oh, well, there you go.
That was pretty scary.
Works, so.
Yeah, it was quite scary to see that, to be honest.
Yeah.
Doctor, what do we do when, this is probably less serious, where a crown is lost or maybe a filling is lost? What should we do?
Okay, so if a crown feels loose, you want to try and get it out of your mouth, because you don't want to have it come loose and then you choke on it or you inhale it at night. You want to don't try and stick it back yourself. Just put it in an envelope or a big Ziploc bag. If you put it in a tissue, you'll definitely throw it away. 90% of the time, if a crown comes loose because you're chewing a toffee, the dentist can just clean it up and re-cement it. If you go back in within a day or two, you don't want to leave a crown out for a week, because the teeth start shifting, and then you're going to have to get impressions or a scan done and get a new crown. So ideally, you want to get your crown re-cemented immediately or within a day or two. You can get temporary dental cement at some chemists. I don't know how available those are in South Africa. If it's not a sensitive or it's not in the front, the best is for a dentist to re-cement it. We are always available for patients of record, and during the week, Monday to Friday, when we open, if somebody calls and we can fit them in and help them out, we do. If a crown has come out more than once, then it's time to get a new crown because it means that something's not fitting correctly. If a filling feels loose when you're flossing, it's best to see a dentist as soon as possible, because if a filling is rattling around and it hasn't actually come out, that's when you can get quite a lot of decay under a filling that's come loose but is still intact.
Okay, and now let's say you bite on something hard. You're going out for the evening and you bite on something hard in the restaurant and you hear crunch. And now you see, oh no, I've got a chipped tooth or my tooth is now cracked. What are the immediate actions that one can take?
So that's a great question, because I think in a future podcast, we must definitely speak about something called cracked tooth syndrome. When you bite hard on something, if you're eating something soft like a hamburger and there's a little piece of bone in there, or you're eating a salad and you hit maybe a walnut shell, or you're eating some olives and you don't know that there's a pip inside, and you bite down on something that you think is soft and it's something hard inside, you can actually get a partial crack in your tooth. And when a dentist looks in your mouth, they may not see anything, but the tooth can subsequently be painful to biting. You definitely want to get something like that sorted out before the tooth splits, because then you can lose the tooth or a large piece can break off. We'll go into that in a lot of detail in another podcast. But if it's a front tooth that's got a large filling and you've broken a corner off, you want to obviously get in and see the dentist as soon as possible. But it's not urgent other than a cosmetic emergency. If your tooth is actually split and it's loose and the two sides of the tooth are in your mouth, you want to try to see the dentist the same day or the next day, because you can get quite a severe infection in a case like that. And just stick to soft foods until you can see the dentist. If you start getting swelling can take a good few days after anything like this. You won't get immediate swelling, but you can use a cold compress if you've got swelling, and rinse with warm water to keep an area clean. But like a little chip or a crack or a piece that's fallen off a tooth is generally not as serious as one would think.
So something a little more common would be a toothache. A lot of people get toothaches and sometimes they pop a Panado or Gen Pain and then they're fine again until it happens again. But when is a toothache actually considered a dental emergency, doctor?
Okay, that's great, because we've spoken about toothaches before, but for people who haven't heard that, the podcast on toothaches, as I mentioned earlier, if you're getting a toothache, it starts off just a bit niggly or just with hot or with cold, and it's not yet an emergency. If you leave it, then you start getting into the situation we're talking about now. So severe pain that's intense or persistent, or if you drink something warm and it's like a deep throbbing, that's a sign of infection or an abscess, and you don't want to wait to the next stage, which is swelling or fever. You can start getting an even more serious infection where your cheek under your eye swells up, or down near your the corner of your jaw, and it can even cause your throat and everything to swell. And then pain on biting may indicate a cracked tooth or a severe cavity that needs immediate attention. So this is a little bit different to, you're drinking or eating something cold and then the tooth hurts for a minute or so. We're talking now persistent pain. I would definitely consider that a dental emergency.
Mm. And then something else that sounds quite serious is a severe tooth abscess, and I think that is it can have some serious effects on your health if left untreated. Let's say you've got a severe tooth abscess now, but you can't get to the dentist immediately. What do you do?
So the common things are to rinse with warm salt water to help reduce pain and draw out any infection. If there's swelling on the outside, you don't want to put heat. You want to put an ice pack for a few minutes on and a few minutes off. Don't put ice directly on your face. Wrap the ice in a wet, moist dishcloth. Over-the-counter pain relievers like ibuprofen. I usually recommend 400 milligrams ibuprofen, which is 2 Nurofens with food 4 times a day, and then 2 Panados, 1,000 milligrams of Panado in between the Nurofen. That works for a lot of toothaches. And dentists listening to this and even doctors might not like what I'm about to say, but if there's absolutely no way you can get in to see a dentist and your face is starting to swell and your neighbor or your husband or wife has some leftover penicillin or amoxicillin and you're not allergic to it, I would recommend going on to just plain penicillin or amoxicillin right away. Some chemists in South Africa are quite friendly that way, especially if you know your chemist and they know that you're not allergic. They may give you or sell you a few penicillins over the counter until you can get in to see the doctor or save you a trip to the emergency room. I don't really recommend that route, but since this is about save your money and save your teeth, that's my opinion. If you're on antibiotics like amoxicillin or augmentin, which is a type of amoxicillin, for 24 to 48 hours and the swelling is increasing, that's very serious. It means that you've got a bacteria that's resistant to the amoxicillin and you need a second antibiotic. You also, once you start on the antibiotic, say somebody gives you 5 or 6 leftover ones, then you take it according to the directions. You don't want to just do that and then after 2 days the swelling's going down and then you stop, because then you'll be in for big problems. A course of antibiotics should last anywhere from 5 to 7 days in most cases. So I know that can be a bit controversial, but that's what we do on this podcast. We just try to give everyday types of information. That's my own opinion.
So, in the case of bleeding gums or maybe a swollen jaw for whatever reason, how can this be managed before we go to a dentist?
So, yeah, I think pretty similar. The warm salt water, the cold compresses. If it's bleeding gums, generally it's not an emergency. If your gums are bleeding, this means you got to brush and floss better. If you got bleeding because you had an extraction and now the clot has come loose, you want to go to the emergency room. Well, you can actually, there's ways to stop bleeding if it's a recent extraction, but if it's bleeding a lot, you want to contact the dentist or the oral surgeon that did the extraction. If perhaps you had an extraction and you didn't tell the dentist that you were on blood thinners or aspirin, that can be very serious. You definitely want to go to the emergency room. But bleeding gums is not an emergency. You can get over-the-counter mouthwashes with chlorhexidine. Don't want to use them too long. Corsadil is one. And then there's other ones that don't stain your teeth. We do have podcasts about bleeding gums. I think, listen to the previous podcasts.
So our final question for today, Doctor, what are some common mistakes people make or maybe myths of what they do during a dental emergency that can actually worsen the situation?
So the one thing is believing the pain will go away on its own. Assuming dental pain that will resolve without any treatment can definitely lead to serious complications. So don't believe it's just going to go away. Using clove oil excessively. So clove oil, we all know what oil of cloves smells like. It's the smell when you used to go to the dentist, there was a smell of clove oil. While clove oil can provide temporary relief if you put it straight onto a cavity, it's not something I believe in, and overuse can definitely irritate the gums or maybe lull you into a false sense of security, and then you end up with an infection. Same thing with hydrogen peroxide. Some people put hydrogen peroxide directly on a dental wound or on an abscess. Not recommended. Rinsing your mouth out with alcohol like whiskey or vodka or brandy, while maybe swallowing it will make you feel better, but don't rinse with alcohol, and don't drink too much alcohol if you're going to be heading off to the emergency room. Chewing on aspirin or putting aspirin directly on the tooth or on the gums, this leads to something called an aspirin burn. It's not recommended. Something that sometimes people use is they put baking soda. I don't recommend it. Don't rinse with vinegar. Vinegar can erode your enamel and make your teeth very sensitive. Something else to avoid. And don't ignore professional advice. If a dentist has told you, come back and get a root canal before this tooth gets worse, listen to what the dentist is telling you, or go get a second opinion, but don't just leave it. And some people think that if you use a cold sore remedy, it will also work for some kind of dental injury. And that's a lot of nonsense. Just go and see the dentist. Don't put cold sore ointment on an infected gum. It's not going to work. So bottom line is, go to see the dentist every 6 months, brush and floss, listen to our podcasts, and one shouldn't have to ever endure any of the stuff that we've spoken about, except, of course, getting a tooth knocked out on the sports field if you're not wearing a mouth guard, which is now, as you know, also preventable. So I hope people listening to this podcast don't end up with any of these problems, but if they do, now they know what to do.
Exactly. And thank you so much, Doctor. This was very, very interesting today. And now we know what to do in a medical emergency or dental emergency, thanks to Dr. Yudelman. Once again, thanking you for sharing your expertise with us, Doctor.
Thank you very much, and see you next week.
Absolutely. And that's it for another edition of Save Your Money, Save Your Teeth. Remember, while we strive to provide valuable insights, always consult with your own dental professional for tailored advice to your personal health. And don't forget to subscribe for more enlightening discussions. And join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.